Welcome to the Superior Education and Patient Promotion Platform. Last time, I talked to you about your rights as a patient when you go to the clinic. Today, I'm looking at what are your responsibilities when you go to the hospital. Yes, you have some responsibilities. Healthcare is a partnership between the patient on the one hand and the doctor, the healthcare facility, and government on the other side. Therefore, most clinics that are running in Ghana are registered by a government agency called HEFRA, and Superior is one of them. We are recognized by them. The important thing for you, your responsibilities, include being truthful to the healthcare providers. They want to know, when did your illness started? When did your illness start? How long have you had it? Is it getting worse? Is it getting better? Are there other symptoms that have come since you noticed the illness? It is important to be truthful so that they'll have the information. After the history taken, they will do what we call physical examination, where they will invite you to a table or couch or examining bed, and the doctor will examine you from head to toe. At this point, they may ask you to take off your clothes. For this reason, it is important when a male doctor is going to examine a female patient that the nurse or chaperone be there. Because when the patient is naked as a woman in front of a man, it's embarrassing. And also to be sure that the doctor does what is necessary and not take advantage of the woman. Also, for children, it is usually advisable for the parents or parent or guardian to be there to assure the child that the stranger that she's meeting is a friend and not an enemy. So after the physical examination, the doctor may order some lab tests. Yes, you can decline the lab test, but then you are asking the doctor not to make a diagnosis. So your responsibility is to make sure that whatever test the doctor is asking, you ask questions to see why he wants those tests, but you will cooperate and do those tests. So after history taking, physical examination, laboratory tests, the doctor then makes a diagnosis. And then your treatment is dependent on what the diagnosis is. Your responsibilities after the diagnosis is made is to go and buy the prescription and take the medication as prescribed for the number of days that the doctor has said you take it. If you don't cooperate in this way, you may end up establishing a resistant disease in your own body, which is not helpful to you. Like and share with family and friends. Tune in next time.